Governor Walker's school mental health initiatives, which is $6 million in new money to go to our schools, to provide training to teachers, and to provide mental health services within our schools. And I urge you to treat it as not a swap for money in our general ed funds or our special ed funds. Thank you so much for your time.
Thank you very much. Yes, sir.
Good morning. My name is Tyler Brown. I'm from Milwaukee, Wisconsin.
You need to bring the microphone either up or go down to it, one way or the other. There you go.
Good morning. My name is Tyler Brown. I'm from Milwaukee, Wisconsin, and I'm here to speak a little bit about transitional jobs. Transitional jobs has really helped me, has given me a lot of life. I am a felon. It was hard for me to get a job. I kept getting turned down because of my background. I became depressed and felt like less of a man because I couldn't take care of my family and I was homeless. Then I heard about transitional jobs and what they was about, so I gave them a shot, and then they have helped me so much in so many ways. I gained so much and met a lot of good people working with transitional jobs and the coordinators, and I am really grateful for them. I think that y'all should raise the funding to $15 million so people like me could get a chance at a work experience and a good life. Thank you.
Thank you. Yes, ma'am.
Good morning, Representative Nygren and Senator Darling and members of the committee. My name is Eva Dicker-Eisman. I'm a community advocate, a sign language interpreter, a retired teacher of the deaf, and a mental health provider. My parents were both deaf. Today, I'm here to ask you to allot money in the budget to establish mental health services for the deaf citizens of this state. Representative Brostoff and Senator Darling have been working together on this issue. The deaf, hard of hearing, and deafblind communities have long been underserved. Since 1970, there have been a number of statewide committees that were established to make recommendations about mental health services for this population. In 1978, legislator Jim Weiner chaired a governor's committee studying the needs of the deaf population. I served on that committee, which made recommendations regarding mental health. I'm sorry to say that not much has changed since 1978. Frankly, I'm frustrated because so few of the mental health recommendations were funded and implemented. It's important for money to be allotted in this budget in order to establish services for this underserved population. There are almost no mental health services in Wisconsin that are linguistically and culturally appropriate for deaf individuals. They have the same mental health issues that hearing people do, and still there are too many barriers to full access. It's easy to discount people who do not shout out for services, and unfortunately, literally and figuratively, this is true in the deaf community. They don't get the resources or the attention they deserve. My own father was frustrated and angry about his deafness. He knew he was smart, and yet he didn't understand why his deafness and immigrant status prevented him from accomplishing all that he wanted to. At times, he was very depressed. Because of his deafness, he did not have access to professional psychological help that might have helped him and our family. This is still the case for many Wisconsin citizens who happen to be deaf or hard of hearing. We need a program and a budget to run a program that will address the preventive treatment and needs of this population. The states that do have adequate services have been forced to do this because of legal suits brought against them. It's an expensive way to get services. We have wide community support, and we have received many letters from consumers and professionals. These letters are available. Thank you very much for the opportunity to speak.
Thank you. Yes, sir.
Good morning. My name is Carl Locke from the town of Brookfield. After many years of working for a living, I now enjoy a healthy and active retirement. For this, I consider myself very lucky to have received employer-sponsored health insurance throughout my 40 years of continuous employment. Many others in Wisconsin have not been so lucky. Over 1 million people in Wisconsin rely on Badger Care and other programs for basic medical assistance. These essential programs help kids, seniors, pregnant women, people with disabilities, and those unable to find a job that pays a living wage. Since 2008 recession, 150,000 more Wisconsinites are still living in poverty. Wisconsin is proud to say it has created a healthcare system that covers everyone, Unfortunately, had we adopted Medicaid expansion, we would have saved the taxpayers of our state $200 million per year. By the year 2020, the lost savings will amount to over $1 billion. The benefits of Medicaid expansion go beyond saving $200 million per year. By moving 83,000 people from the marketplace back to Badger Care, we will reduce the insurance costs for those remaining in the marketplace, provide usable health care for those struggling just above the poverty line, and free up money to be invested in worthwhile programs like those that prevent and treat mental illness and drug addiction. It's time the Wisconsin legislature say yes to Medicaid expansion.
Thank you. Yes, sir.
Good morning. My name is Shelley Roeder. I'm a resident of Milwaukee, and I work at the Cathedral of St. John the Evangelist. And in those hallowed halls of the Mother Church of the Archdiocese of Milwaukee, one thing I hear in Scripture is free the captives, free the captives. Well, here in Milwaukee, when we free people from prison, we keep them held captive by not allowing great opportunities for jobs. I'm here to speak in support of the Transitional Jobs Program and to ask for your support in $15 million of extra funding for that program to expand opportunities. At the Cathedral, we were able to hire a transitional jobs employee who fulfilled a 6-month placement with us and moved on to full-time employment. The experience was one that was extraordinary for all of us involved, and I was amazed at the amount of the way that people are shackled, really, when they get out of prison, because of hunger, because of poverty, because of lack of transportation, and the lack of jobs that really support them. This program really allows for people to transition, and we ask for your support.